Hi, I'm Dr. Carey Hemmelgarn. We're starting Module 7. Module 7 is going to include insecticides and molluscicides. Insecticides. These medications can be problematic when given to the wrong pet or consumed at large doses. When we see them given to the wrong pet or in large doses, we can see toxicity secondary to them. Pyrethrin is a chemical that's used for small animal flea control. This medication binds to sodium channels on nerves and affects the conduction of these nerves. Pyrethrin is absorbed orally or topically across the skin. Pyrethrin is metabolized in the liver and then excreted in the urine. Permethrins are safe in dogs and have a low risk of toxicity if given appropriately. Small dogs are at risk of toxicity if they're given large dog doses of that medication or if they have inadvertent ingestion of large amounts. Cats, unfortunately, are much more sensitive to permethrins and permethrin-like substances and should not be used for flea control in cats. Cats' intolerance stems from their decreased ability for glucuronidation. We talked about how glucuronidation affects cats being more prone to acetaminophen toxicity. Well, that also stems why they're more prone to pyrethrin toxicity. The most common toxicity is in cats when they are given a dog product that's placed on them, or that cats are in close contact with a dog that has that topical spot-on therapy, and then they clean or ingest that spot-on treatment off of the dog. Clinical signs with pyrethrin toxicity are muscle tremors, seizures, hypersalivation, hyperthermia, vomiting, and depression. Decontamination is recommended if a topical product has been applied. So that's, again, giving them a bath with that bland Dawn dish soap. That's going to try to remove any of that topical product that may still be left on them. The treatment is IV fluids, methocarbamol to try to minimize that tremoring, controlling seizures with anticonvulsants, and IV lipid emulsion therapy is very helpful in treatment with cats with this toxicity. Fipronil is a phenylprazole insecticide that is the main ingredient in topicals and sprays and can also be found in some roach traps. Fipronil works by binding to GABA receptors and blocking chloride channels. Fipronil in pets is not systemically absorbed, and instead it's absorbed across their sebaceous glands when it's administered on their back. Once it's absorbed in the sebaceous glands, it's then released into their follicular ducts, so it isn't absorbed systemically into their body. The toxicity is low in a product when used appropriately, and safety studies have shown that doses up to 5 times the recommended dose does not show any signs of toxicity in our pets. You can see hypersensitivity locally in the skin, which is something that we can see with any topical product, but Fipronil is a product that can cause this hypersensitivity. This has been reported even when appropriate doses have been given, we can still see hypersensitivity on their skin, and it commonly will respond with supportive care. Fipronil can cause seizures in rabbits when it's used off-label, so should not be used in rabbits. Imidacloprid is an insecticide that's used for flea control in cats and dogs. It is something that is a topical medication, and again, it is commonly used in different products in veterinary medicine. It works by preventing acetylcholine from binding and results in paralysis of the insect. Imidacloprid is a safe insecticide when administered appropriately, and that oral administration of this topical product can cause vomiting and hypersalivation, but the signs usually tend to be mild and self-limiting. Signs of toxicity, if they were to occur, would include lethargy, tremors, and muscle weakness. Again, but toxicity is rare with this insecticide. Selamectin is a semi-synthetic Ivermectin and is the main product in flea and tick medications for dogs and cats. This has been shown to be safe for dogs and cats, and it's been tested, and it has been tested to be safe for collies that have the MDR mutation. It's also safe in heartworm positive dogs and cats, and so it's an incredibly useful drug that we use commonly. If given orally, we can see hypersalivation and vomiting occurring if we give it orally instead of topically. And diarrhea can be seen 24 hours after administration in some pets, but it isn't necessarily a toxicity. It's just something that has been noted in some pets. Ivermectin, which is different than the Selamectin we just talked about. Ivermectin is a mixture of 23-22 dihydroivermectin, B1A, and B1B. This is produced, interestingly, it's produced from a fungus, the Streptomyces ivermectilis, and can be used in dogs, cats, livestock, and horses. Toxicity with ivermectin can be seen with overdose or with dogs that have a mutation in the MDR1 gene. Dogs that have this mutation are highly sensitive to ivermectin and can exhibit toxicity when administered higher than the heartworm preventative dose. The heartworm preventative dose that we've seen toxicity in dogs associated with it is 0.006 mg per kg to 0.024 mg per kg. Dogs with MDR mutation can show signs of toxicity with doses as low as 0.2 mg per kg. We commonly see toxicity associated with ivermectin in farm dogs that ingest horse and cow dewormer in large doses, but it can also be seen with inadvertent administration orally or injectably, specifically in pets that have that MDR1 mutation. Clinical signs include depression, ataxia, hyperesthesia, hypersalivation, seizures, respiratory depression, coma, and death. Absent menace reflex is a classic sign of ivermectin toxicity, and the diagnosis can be based off of exposure, but also we could check blood or tissue levels for the presence of ivermectin. Treatment is symptomatic, and lipid therapy can be very helpful in that. And in severe cases, mechanical ventilation and hemoperfusion is recommended, specifically when they are comatose or they lack a gag reflex. Recovery for dogs that get into ivermectin toxicity can be prolonged with clinical signs that can last for days to weeks, and in some studies, dogs being hospitalized for weeks waiting for full recovery. Organophosphate toxicity has been fading in frequency due to phasing out this type of insecticide due to its high toxicity rate. So it's not as commonly seen as what we previously used to see it in veterinary medicine. Pets exposed to organophosphates will have our classic SLUDE signs. So that's going to be our salivation, lacrimation or excessive tear production, urination, defecation, dyspnea, and emesis. So that's going to be our SLUDE acronym. Bradycardia is also something that can be seen but is not noted in all cases. Large doses can have neurologic signs such as tremors, seizures, comatose, and death. Clinical signs can progress to days or weeks depending on what product they ingest and how much of that product that they get into. Decontamination is very important due to the severity of clinical signs if there's been recent ingestion and pets are not showing clinical signs. And treatment is supportive. Atropine can be given as an antidote, and it's recommended to give a quarter of the initial dose, which is 0.1 to 0.2 mg per kg, IV, and then the rest given IM or sub-Q. And pralidoxidine chloride or 2-PAM can be used, which releases acetylcholine and can improve signs in some patients that get into this toxicity. So now we're going to go into types of molluscicides. Metaldehyde is a cyclic polymer of acetaldehyde, which is the active ingredient in molluscicides that control slugs and snails. Metaldehyde is metabolized in the stomach, interestingly enough, to acetaldehyde. And then enterohepatic recirculation occurs very commonly and at high levels with this toxicity. Metaldehyde reduces the GABA concentration in our central nervous system, which causes overexcitation. And clinical signs include muscle tremors, hyperexcitability, hyperthermia, tachycardia, and a very severe progressive metabolic acidosis. Seizures and coma are seen in end stages of this toxicity. Diagnosis can be made by exposure history or blood or tissue levels, but there's no easy bedside test available. And decontamination is very important if ingestion is detected early on and before we start to know clinical signs. Activated charcoal, if can be safely administered, should be administered to try to limit that enterohepatic recirculation. And treatment is supportive based off of clinical signs. That's going to be your IV fluids, managing your hyperthermia, methocarbamol to limit muscle tremors. And in horses with metaldehyde toxicity, xylazine has been shown to help with clinical signs. There hasn't been studies in small animals about this. Another toxicity is strychnine. So strychnine is an indole alkaloid that's obtained from the seeds of Strychnosis nux vomica and Strychnosis ignata. Dried seeds are used to make strychnine powders, extracts, and solutions that contain strychnine. This is mainly used as a buried pesticide for burrowing rodents, but that unfortunately malicious poisoning has been seen in small animals with this toxicity, or if pets go and dig up this toxicity, this toxin, we can see this toxicity. It's rare for strychnine toxicity, but it is something we should have on our radar, which our clinical signs are going to include tremors, vomiting, ataxia, hyperthermia, hyperesthesia, seizures. Strychnine is a competitive and reversible inhibitor of glycine, which is an inhibitory neurotransmitter. This toxicity causes stimulation of motor neurons, causing generalized rigidity and tonic-clonic seizures. Diagnosis is either by known exposure, compatible clinical signs, or blood or tissue levels, but there's no bedside test to look for this. Decontamination is incredibly important if it's early on in ingestion, and treatment is managing seizures with methocarbamol, diazepam, and oftentimes either propofol boluses or CRIs, depending on their clinical signs and their improvement with supportive care. Mechanical ventilation is needed in some cases, depending on the level of respiratory depression and whether they are conscious or not. So, chlorinated hydrocarbon compounds. These compounds are used as insecticides and can cause toxicity if exposure in small animals. Benzene hexachloride has been used as an insecticide in large animals and in dogs, but is highly toxic to cats. Chlorinated hydrocarbons are generally CNS stimulants, and clinical signs include neuromuscular tremors and convulsions. Interesting, the tremors usually start at the face and then extend caudally through the body, and that a diagnosis is based off of possible exposure, compatible clinical signs, and blood and tissue levels. So this finishes up the end of Module 7, which was insecticides and molluscicides. Thank you so much for joining us. Module 8 is going to feature outdoor hazards.